So this is a little lovely vagal toning breath that we're going to take our clients into. So I'd like for you to start with your palms open, just like this. And as we inhale, we're going to gently lift the arms with palms open, like this. And as we exhale, we're going to turn the palms down. And I want you to imagine as if you're pressing the breath out, almost like an accordion, sort of pressing it out upon the exhale. And each of us is going to have a different rhythm of how long that takes. So we'll just do it together for 3 rounds like this. Inhale up. And exhale, press away. Really slow, as if it's taking you some effort to press the breath out and away. And again, inhale up. And exhale, press away. Again, like it's taking effort to press every last bit of breath out. Just notice what that's like to slowly press away. And we'll take one more like that. Inhale up. And exhale, slowly press away. Slowly press away, step by step, as if you're squeezing it out a bit. And now we're just going to let the hands rest. So I'd like you to just let your hands rest in some way, one over the other, or maybe one inside the other, or clasped together. So just let your hands rest in some way. And just stay for a moment and see if you can notice what it's like to just have the hands touching. What's the sensation of the hands touching? And I'll give you some pieces that you may be able to focus on, such as the temperature of each hand as you touch it. Even notice what the experience of your touch is like. Are you squeezing? Are you just bringing them together gently and pressing? Are you moving? Just some of the things to notice there with that touch. And now I'd like you to take one hand, just rest it down, and we're going to take the other hand. And as you take an inhalation in, I'd like you to kind of feel around with that one hand where you can feel the breath coming from. So when you take an inhalation in, just kind of move that hand around, almost like it's a little scope searching for the inhalation. So where is that inhalation noticed in your body as you breathe in? Is it in the throat? Is it in the chest? Does it feel like it's moving from the belly? So just exploring where that inhalation comes from with that touch, step by step. And now we're going to do the same for the exhalation. So when you exhale, I'd like you to notice where you can feel the breath leaving. So you're going to move that hand around. So sometimes that even gets moved to the back body, right? So when I exhale, you can actually feel that in my low back. So where in your body can you feel the exhalation leaving? Does it land in the chest, in the shoulder, the belly, the back body? So just noticing where that exhalation lands. So just discovering that, moving the hand around for just another breath. You may take one more round of moving it to discover the inhalation, and then moving it to discover the exhalation. And then slowly release the hand. And then begin to come on back. And I like to invite my clients to come on back if the eyes have been closed, to invite them to come back first with a gaze that's open just downward and then around the room, so that they can gain some anchors around the room first and then come back on with you. So again, we'll take a moment for you to jot down what your experience was like, anything that you're sensing, noticing, attending to now, descriptives that you came around with, that you came up with, feeling that you noticed in the body, in the sensations that were present, and then just share that in the chat after you've made note of it yourself. Yes, can the exhale and inhale points be the same location? Absolutely. Everyone's breath is different. This is all we're doing here right now, is a dropping in to the experience of their breath or your breath in this very moment. And what's neat about this practice is sometimes I like to do this both in the beginning and the end a little bit, because what's neat is for our clients to discover the variation of what happens. Yeah. Yeah, reconnected. Some can notice where it was coming from, but still felt like that disconnected. Useful to track the breath. You noticed where you were moving it. Yeah, they're interesting to notice the differences of where it comes from. Feel more connected, more whole, more tension without realizing it until, yeah. So again, like I said, these somatic practices will bring the awareness of all, right? Pleasant, unpleasant, and neutral. Yeah, feeling the breath travel. Yeah, it can be aware of the locked breath. Yeah. Feel like you never explored where the breath comes from. Exactly. And that's going to be actually our clients as well. So, yeah, odd that you experience the exhale in the base of your spine. Yeah, sometimes it's very interesting to discover kind of where the inhale, exhale is. Yeah, and this is a good one where Alyssa said it's hard to stay non-judgmental if the breathing was off, right? So just so you know, one of the things that's extremely important as to say to your clients from the very beginning with any somatic practice is there's never a right or wrong here. We are never after a certain goal. Somatic practice is always going to be about awareness, and whether that awareness they believe is a positive or negative, we're going to really cut that from the start for them, because this is always about awareness, and all awareness is helpful. So if somebody has noticed and has said, well, wow, this is really difficult because my breath is all here, I'm like, that's great. All I want you to do is notice where it is, because this is the first step in being able to teach the deeper steps that we're going to go into, which is about their nervous system and about what's happening in their brain, right? So we have to start somewhere. And that grounding practice and this breath practice are the little baby steps of introduction. You're introducing them to the words that you're using. You're introducing them to things that they never notice. So we start with the simplest first, which is just the grounding of the body, where the body is located, even a proprioceptive piece about the body. Where is it located? Sometimes I have my clients just touch their hands down to the chair beneath them, knows, okay, I see, my body is here, actually, it's connected here, right? Even if I don't feel like I'm connected to it, it's connected somewhere here, right? And then we start off with these simple yet challenging practices, right? Because a lot of times what clients are going to notice is, as some of you notice, that oh, the unpleasant came alive too. I started to notice the things that I don't like, or I started to notice the pain experience. That's all part of this awareness, right? We're starting to build tolerance from the inside out through increasing this awareness slowly.